We need to get the city's resources into the parts of our community where people need them most.
The managers of Denver's syringe access and sharps disposal programs need to do more to ensure city resources are allocated efficiently to support success in reducing harm and connecting people to health services.
Denver's syringe access and sharps disposal programs are important to supporting people and getting the help they need. We completed an audit recently looking at how the city is tracking and using data to determine if its harm reduction programs are successful. We found gaps in communication and missed opportunities to use complete data and to assess and help direct programs more effectively. Syringe access and sharps disposal programs seek to reduce harm for the community at large by providing access to sterile injection equipment and safe disposal options. These programs do not include safe injection sites. Sharps disposal programs are available for many different types of needs and people, including safe ways for people with diabetes to dispose of needles.
The city contracts with 3 community partners for syringe access programs and runs 1 mobile program through the Department of Public Health and Environment. The city's Wellness Winnebago provides general wellness services, including syringe access, but has been repurposed in 2020 for COVID-19 response.
Our audit looked at how the city is working with providers to reach the parts of our community with the highest need, and we found some areas for improvement. We found a lack of communication and trust between the city and its service providers. We used research and data analysis to look at where programs are available and where the city actually sees the most cases of substance misuse or reports of improperly disposed syringes. As an example of how the city could use information from the 311 reports and other data, we made this map showing where most crime reports of drug use, drug sales, overdoses, and needles were. We compared that to where the city's current syringe access programs are located. As you can see, syringe access facilities and sharps disposal locations are not always near the highest need areas. Using available data and other sources of information as a starting point, program managers could deploy limited resources, such as mobile units, more strategically.
Our audit found that by more regularly analyzing existing data, collecting the right data, and conducting needs assessments, the city could better understand the risks and areas of concern, as well as better allocate resources.
The audit team also found a lack of communication and coordination with service providers, contributes to the provider's distrust. The city could also use partnerships with agencies like the Department of Parks and Recreation to assess more areas of need, especially for sharps disposal locations. Finally, because the program duties are spread across multiple staff members, we found several instances where different people on the same team all thought someone else was taking care of specific tasks or projects. Decentralized management leads to miscommunication. By ensuring complete and accurate data, the Department of Public Health and Environment will have the necessary tools to evaluate and efficiently manage its programs. Well, that's it for this episode of Ask the Auditor. If you have a question, submit it to auditor@denvergov.org, and maybe your question will be the next question we answer on the next episode of Ask the Auditor.